Dr. Brewer, thank you for joining me today.
Oh, my pleasure.
So, this new healthcare bill just got signed into law, and my first question is, your reaction. Are you surprised? Because it looked like a couple months ago this wouldn't get done. I was just wondering if you were surprised or what your reaction was.
Yeah, I would say I was surprised that President Obama was ultimately able to get this through. It really did seem like, particularly after the election of Scott Brown in the Massachusetts special Senate election to fill Ted Kennedy's old seat, that healthcare reform was pretty much dead in the water at that point. There was some constant kind of optimism on the part of the White House that they were going to be able to still get this through, which I really didn't think they had much basis for. But it turns out, they must have known something the rest of us didn't, because ultimately they were able to do it, and the final package looks fairly close to what what the White House was after all along. So I was surprised, absolutely.
What do you think, in your opinion, politically, what finally brought us to this point?
If I had to take a stab at what really stood out this time as it being different, I would say that kind of the coalition of interests that were supportive of some kind of reform to the system was much bigger than it's been in previous years. If you go back to the Clinton example, their insurance interests were almost unanimously opposed to any kind of reform. Big players in kind of the business community were opposed to some kind of reform. In this instance, a lot of insurers were supportive of some kind of change, and they're getting millions of new customers out of this. Business interests were supportive to a certain degree. They realized they needed to be able to lower their healthcare costs. So I think it was a different coalition of support this time, and I think more than anything else, that's what allowed Obama and the Democrats in Congress to push it through this time, where they've been unable to do so in the past.
And what do you see as the benefits of having a semi-universal healthcare system in the country?
Well,
or do you not think there are benefits?
Well, I mean, that's obviously a key point of contention. I mean, there are plenty of people on the right who say there are more cost than benefits to having a system like this. There are those on the left who think that's just a silly question and say, oh, of course, there's a lot of benefit to having something even remotely approaching a universal healthcare system. I think you can make a reasonable case for either of those positions. How it actually plays out as we see the policy get implemented in the coming years, I think will enable us to actually give some kind of concrete answers to that question. I mean, I guess at this point you could make a plausible case either way, but it's only a theoretical case at this point, at least in the American context. We saw for months that public opinion opposing kind of the Obama healthcare reform was pretty steady, somewhere between the mid to high 50s to the low 60s. So we're talking 55 to 60, 62, 63% of Americans consistently for months saying they were opposed to the Obama healthcare plan. So I don't think the opposition was overblown. The question is, was that opposition rooted in really substantive concerns about the policy, or was it rooted more in how the policy was presented to Americans and how it was sold to citizens? An interesting thing, if you ask people about kind of the individual elements that are in the reform, some like, say, what do you think about insurers not being able to deny someone coverage because of a pre-existing condition, to take probably the most prominent example, overwhelmingly supported by Americans. You can find a lot of examples like that of individual pieces of this reform that people support, a majority of people support. So I think it's kind of a mix of substantive opposition, but also maybe people who think the bill is something other than what it is. And I think that's really why in the coming months we're going to see the battle for healthcare isn't over. Okay, it's law now, but the battle now moves to trying to shape the perceptions of the American public about what the bill actually does.
How about the post-vote uproar and your reaction to some of the communist claims of threats of violence and what that made you think?
The threats of violence, I think that's a different matter. That is something that really is unusual. It's happened before, but it's pretty rare. And I would also say that it's relatively disturbing. There are plenty of legitimate reasons to be opposed to this policy. There are also plenty of legitimate ways to work to deal with that opposition and to try and repeal the policy or change it. making threats of physical harm against policymakers or threatening their family or destroying property are not on that list of legitimate ways to deal with this. And I think that is something that we really need to be concerned about here.
All right, well, that's it for my questions. Dr. Brewer, thank you for joining me today.
All right, my pleasure.